Hello and welcome to the training video for this year's Community Pharmacy Seasonal Flu Vaccination Service. My name is Kerry Grimes and I'm a Service Support Pharmacist with CPNI. The COVID-19 pandemic has highlighted the importance of ensuring health and social care workers are protected against disease. While there is currently no vaccine against COVID-19, there is a vaccine against seasonal influenza, and it's important that frontline staff have access to this vaccine. In order to increase uptake and meet this year's target, it is important to encourage health and social care workers to have the vaccine and remove barriers to accessing the vaccine by making it more easily accessible through community pharmacy. So what's the rationale behind the service? Well, health and social care workers that have direct contact with patients are 4 times more likely to come in contact with flu than the general population. We hope to reduce transmission of influenza within the health and social care premises and thus indirectly contribute to the protection of individuals who may have a suboptimal immune response to the flu vaccine, and also to avoid disruption to health and social care services that provide patient care. Influenza outbreaks can arise in health and social care settings with both staff and their patients affected. Vaccination of health and social care workers against influenza has been shown to reduce the risk of influenza infection amongst staff and associated absenteeism, and significantly reduce rates of influenza-like illness, hospitalisation and mortality in the elderly. The Community Pharmacy Seasonal Flu Vaccination Service was launched this week, commencing on the 28th of September, and will run until the 31st of March 2021. All health and social care workers, including trust, non-trust, frontline and non-frontline staff, can be vaccinated as soon as the pharmacy has received the first delivery of the vaccine. Department of Health policy recommends the flu vaccine for all health and social care workers working in Northern Ireland. In 2020-21, as part of the Community Pharmacy Seasonal Influenza Vaccination Service, vaccination should be offered to health and social care workers aged 16 and over, including but not limited to all health and social care employed staff, health and social care employed by a registered residential care or nursing home, which provides care for vulnerable patients who are at increased risk from exposure to flu, health and social care staff employed by a registered domiciliary care provider, which provides care for vulnerable patients who are at increased risk from exposure to flu, health and care staff employed by a voluntary managed hospice provider, which provides care for vulnerable patients who are at increased risk from exposure to flu. And for clarification, includes the following health and social care workers: primary care staff, including all staff in GP surgeries, community pharmacy, dental practice and optometry practices, all staff working for the Health and Social Care Board, BSO, PHA and RQIA, all staff working in supported living settings and hostels. Whilst the flu vaccine is recommended for all health and social care workers working in Northern Ireland, vaccine uptake surveillance is only routinely collected for frontline staff employed by health and social care trusts. Vaccine uptake for trust-employed frontline health and social care targets have been set by the Department of Health and can be seen in the table. The 2019-20 end of season uptake for health and social care workers was 41.2%, which was an improvement compared to 2018-19, which was 35.4%. Before you commence the service, I would recommend you visit the following website: pha.site/CPFV, and it will contain all the relevant documentation, so I suggest you familiarise yourself with the resources available, and that includes any community pharmacy update letters, the flu e-record form on the help file, the service specification, the PGD, the privacy notice, the definition list of health and social care workers, the pharmacy checklist, your service contract, the community pharmacy poster and the social media plan. So next we'll go through a few areas that you need to prepare to provide the service. The community pharmacy contractor must ensure and confirm that pharmacists providing the service are working in line with the national minimum standards and core curriculum for immunisation training. Pharmacists are declared competent to undertake immunisation and discuss issues related to immunisation. Pharmacists providing the service should have undertaken face-to-face training for injection technique and basic life support training. The service spec can be found in the BSO website and must be followed. I advise you to read the patient group direction and ensure you fully understand the content, including eligible patient groups, the inclusion and exclusion criteria, and the record-keeping requirements. Complete the practitioner declaration on the PGD to confirm you have read and understood the content of the PGD and that you're willing and competent to work to it within your professional code of conduct. You must then also complete the authorising manager section of the PGD. An authorising manager must sign a copy of the PGD in the pharmacy that they are responsible for. The authorising manager's role is to confirm the pharmacist is aware of the service spec and requirements needed to provide the service and has completed the relevant training as per the training requirements in section 6 of the PGD and is deemed competent to provide the service. Also must have the organisation's approval to provide this service. The pharmacy contractor must ensure an SOP is in place to support delivery of the service, which covers the following points as a minimum: provision of the service to patients and the roles of different staff members, ongoing conditions under which the service needs to be provided, the handling and storage of vaccines and maintenance of cold chain integrity, the system for arranging appointments if applicable, system for administering the vaccine including off-site provision, needle stick injuries, identification and management of adverse reactions, handling, removal, safe disposal of any clinical waste related to the provision of the service, appropriate anaphylaxis arrangements, appropriate infection control procedures to include but not limited to PPE requirements and disposal, environment decontamination, social distancing, face coverings for the public and hand hygiene. Indemnity insurance should also be considered, and the pharmacy contractor to ensure that appropriate indemnity arrangements are in place to provide this service, including any provision of vaccines is off-site or outside of contracted hours. The pharmacy contractor must ensure that staff involved in the service are advised that they should consider being vaccinated against hepatitis B and advised of the risks should they decide not to be vaccinated. The PHE's advice in the Green Book is that Hep B vaccination is recommended for healthcare workers who may have direct contact with patients' blood-stained bodily fluids or tissues. This includes any staff who are at risk from injury from blood-contaminated sharp instruments. We also suggest you familiarise yourself with relevant documents, for example, anaphylaxis procedures, chaperone policy, needle stick injury procedures, infection control and cold chain procedures. You must ensure you have any necessary equipment and supplies needed for the provision of the service, for example PPE, anaphylaxis pack, clinical waste bin and a spill kit. Ordering of the vaccine will be facilitated via Moviento using the online ordering system. Vaccines ordered from Moviento before 5 p.m. will in general be available for delivery 48 hours later to the pharmacy premises only. Pharmacies are allowed to place a maximum of 2 orders a week. Deliveries will only occur Monday to Friday and no weekend deliveries will happen. This means that if an order is placed on Friday by 5 p.m, order delivery should occur on the following Tuesday. It is advised that pharmacy contractors should only order sufficient quantities to meet their weekly needs to avoid over-ordering, vaccine wastage and minimise delivery costs. Vaccines ordered through Moviento for use within the pharmacy service must only be used for patients availing of the service and should be segregated from other stock, such as vaccines used for the private service. It is advised that pharmacies should order sufficient quantities to meet their weekly needs. However, to avoid additional delivery costs, if the pharmacy weekly needs are less than 10, pharmacies are encouraged to place an order reflective of fortnightly needs. The pharmacy contractor must have an SOP in place for the service, which includes procedures to ensure cold chain integrity and is reflective of the area which vaccinations are to be provided, such as off-site. The pharmacy contractor must ensure that they have fridge capacity to store any vaccines ordered, and all vaccines must be stored from 2 to 8 degrees, stored in original packaging in order to protect from light. The pharmacy contractor must have appropriate vaccine storage facilities to maintain cold chain. All refrigerators in which vaccines are stored are required to have a maximum and minimum thermometer and readings recorded, and those records should be kept for a period of 5 years. As flu vaccination clinics have commenced, the safety of all staff delivering the vaccines and individuals requiring a vaccine is paramount. There is considerable pressure to ensure the safe and prompt delivery of this year's flu vaccine campaign in the context of the ongoing pandemic. The detailed guidance on use of PPE for the flu vaccine service has been added to the BSO's website, and that's the PHA Infection Prevention and Control Flu Vaccine Clinics, and can be found under additional resources. Community pharmacists providing vaccination clinics should risk assess each flu clinic or administration environment to ensure they are COVID secure. So whilst providing the flu service, pharmacists must always use a face mask. A face covering must be worn by all individuals attending for vaccination. Effective hand hygiene must be undertaken between each patient, and additional PPE should be risk assessed. So gloves and aprons are always recommended where there is anticipated exposure to blood or bodily fluids or non-intact skin. The need for single or reusable face or eye protection, such as a full face visor, should be risk assessed where there is an anticipated risk of contamination with splashes, droplets of blood or body fluids. For example, an individual who does not have a fever or other COVID symptoms but reports having a chronic cough. It's worth noting if additional face or eye protection is needed, such as a shield or goggles, this is in addition to the face mask. As a result of the updated guidance, each contracted pharmacy providing the flu service will receive an additional PPE pack supplied directly from BSO PALS containing the following items: 100 gloves, 100 aprons, 50 face masks and 50 eye protectors, and these supplies will be delivered to pharmacies by Tuesday the 6th of October. PPE should be disposed of after each session or earlier if damaged, soiled or become uncomfortable. Pharmacists must ensure there's an enhanced environmental cleaning is carried out, and where possible good ventilation should be maintained. Canon are supporting the service and are delivering 3 1-litre sharp spin boxes during September and October 2020. Eligible health and social care workers have been advised to confirm if their local pharmacy is offering the service, check if there's an appointment system, observe infection control measures, and contact the pharmacy if they're unwell to see if they need to rearrange their vaccination. They must bring staff photographic ID or proof of their employment in a healthcare setting. Prior to vaccination, health and social care workers should have read and understood the information and the privacy notice provided in regard to this service, and understand that upon vaccination they cannot withdraw the processing of their personal data as per privacy notice. The pharmacist should offer a copy of the relevant vaccine manufacturer's patient information leaflet to each patient prior to the vaccine being administered. Be informed of infection control procedures, and the patient must also read and agree to the patient declaration and treatment consent within the flu e-record form. For this service, there is no requirement for the patient to sign. All patients vaccinated through this service must be recorded on the e-form. This is a record that the vaccine has been supplied and administered via the PGD and the Community Pharmacy Flu Vaccination Service. The flu e-record form can be accessed at pha.site/CPFV. For help when completing the flu e-record form, please refer to the e-record form help file. The pharmacy must print or save a copy of the flu e-record form for the pharmacy records and have this available for post-payment verification if required. If the health and social care worker is trust employed, on submission, all patient data will automatically be electronically sent to the relevant trust or NIAS Occupational Health Department to allow them to capture the relevant surveillance data. If non-trust employed, the pharmacy should print a copy and encourage patients to provide a copy of the e-record to their employer. The relevant flu e-record form data will be automatically sent to the BSO for pharmacy payment purposes once the form is submitted. There have been reports of trust occupational health departments receiving flu vaccination e-records for health and social care workers that are not their employees. So it is essential that pharmacists only select trust health and social care worker or trust social care worker on the e-record when they have checked the person's proof of identity and they are directly employed by the trust or NIAS, as per the staff identity badge, payslip or headed letter. All other health and social care workers need to be logged as non-trust employed health and social care workers. Trusts must not receive patient data that does not relate to their staff, so it is essential that pharmacists select the correct employment status and correct employer when completing the e-record form. If pharmacists are providing the service off-site, the pharmacy should ensure there's a process in place for providing a record of the vaccination if requested. It should be noted that the paper-based record form cannot be submitted for payment. Community pharmacies are reminded to review their information governance arrangements if additional devices such as tablets or laptops are used to submit, print or save copies of the e-record form. As the data controller, community pharmacies must process data in line with the data principles outlined in GDPR, and further information is available within the service spec. As mentioned previously, records of flu temperatures must be kept for a period of 5 years. Claims for payments for the flu service will be upon submission of the e-record form and processed monthly by the BSO. Payment will not be made for submitted paper-based record forms. The pharmacy contractor should monitor and record the number of vaccinations completed on a monthly basis for verification against BSO payments. E-record submissions should be made within 48 hours of vaccination and payments will be processed accordingly. In exceptional circumstances, late submissions will be accepted for payment by the BSO up to 6 months post-administration of the vaccination. For the flu service in the 2020-21 year, payment will be $9.92 per administered dose of vaccine plus a £250 fee for setup, including any associated costs. To support virtual consultations and the online submissions of the e-form, funding has been made available to contractors to purchase a tablet device, and further information on this will be made available shortly from the BSO. A social media plan has been developed and will be added to the web page, but in the meantime, keep updated with the various CPNI'S social media channels. We will be sharing promotional photos and posts for you to share. Also, for those of you who have not already done so, please could I encourage you to become a registered member of our new website, which is available to contractors only. All the information relating to the service will be available there. Please do get in touch if you have any queries about the service with myself, Kerry Grimes, or alternatively Greg Miller in the Health and Social Care Board with any operational issues. Thank you very much for listening.